So this video is discussing shoulder bursitis. So you see this term get thrown around a lot, and bursitis is a very common ailment that can happen really anywhere in the body. Common areas, you can see it in the elbow, you can see it in the knee. When we see it in the shoulder, it's actually deep inside the shoulder, and really it involves the rotator cuff. And sitting right on top of the rotator cuff is this tissue called the bursa. And the bursa is in the body where there's any area where you have something that's rubbing over a bony prominence. And so it's just this layer of cells that kind of, they provide almost a cushion or a pad between a tendon and a bone, or skin and a bone. It's very common. And so any areas where there's bony prominences or bone is in contact with tissue, the body develops these bursa in order to kind of lubricate and protect the surface. And in your shoulder, if you have rotator cuff pathology, meaning tendonitis or a tear, the bursa will become very inflamed. You can get clicking, catching, popping from that for sure, but also significant pain. And so shoulder bursitis is really a term that we use to describe someone that's getting impingement or rotator cuff tendonitis is the way I like to think about it. And it's really a rotator cuff problem. So the key to that is figuring out exactly what the problem is. And then once you decide, okay, this is bursitis or impingement or tendonitis, like all three of those things mean the same thing in the shoulder, like rotator cuff tendonitis, bursitis, impingement. They're similar. It's a catch-all term for a very common ailment. You got to figure out that that's the problem, and then once we figure out that's for sure what you have, then we can figure out how to fix it quickly.